Have you ever wondered if the advice you get for health screenings changes as you get older, or if some checkups remains the same throughout your life? It is a common and important question, especially when it comes to preventive care. Yes, your age absolutely affects how often you should get a pap smear. Medical guidelines for cervical cancer screening are specifically tailored to different age groups, reflecting changes in risk factors and the natural history of human papillomavirus infection. The reason age plays such a crucial role is tied to the risk of developing cervical cancer and how our bodies handle the human papillomavirus, which we also call HPV. Younger individuals, typically those in their 20s, are often recommended to start screening every 3 years. This is because while HPV exposure might be common, the body usually clears these infections naturally without long-term issues. As we get older, usually into our 30s through 65s, guidelines often suggest continuing regular pap smears, sometimes combined with HPV testing, known as co-testing. This helps detect persistent infections or abnormal cell changes sooner. For those over 65, if they have a history of normal pap smears and no increased risk factors, they may even be able to stop screening altogether, as the risk of new HPV infections and cervical cancer significantly decreases. To figure out the best pap smear schedule for you, always talk with your doctor. They will consider your personal medical history, any previous pap smear results, and your individual risk factors to recommend the most appropriate screening frequency. This personalized approach ensures you receive the right care at the right time, balancing early detection with avoiding unnecessary procedures. These evidence-based guidelines have evolved over time, moving beyond just annual pap smears for everyone. The shift has been informed by extensive research into the natural progression of HPV and cervical cancer, highlighting that for many people, less frequent screening is still highly effective. Understanding that HPV is the primary cause of almost all cervical cancers helps us appreciate why HPV testing is often incorporated into current screening protocols, especially for those over 30. By staying informed about age-related screening recommendations and actively discussing them with your healthcare provider, you are taking a proactive step in protecting your cervical health. This personalized and evidence-based approach is a wonderful way to ensure you receive the most effective preventive care throughout your life.